In this video, Professor Thomas Seyfried explains how, upon first diagnosis, patients are usually healthy, and then goes on to talk about the treatments. I give you the professor.
So when you get that patient up front, they say, gee, I didn't know I just went down, they found some spot, lump, or whatever. They're healthy at that point. Maybe not as healthy as we would consider metabolic homeostasis healthy, but they were certainly not bald, gums bleeding, all these horrible side effects. That happens after the treatments. That should never happen. That's quackery. That tells me that if you treating patient make their hair fall out and you have all these microbiome issues, what the hell are you doing to these poor folks? You don't make somebody healthy by poisoning and irradiating them. And the new drugs, these Opdivo, Keytruda, and all these crazy things that you hear about, they're all based on the somatic mutation theory. Yes, every now and then you get 20% of the folks will benefit from those. 60% will have nothing, and 20% will be killed. It's called hyperprogressive disease. The drug will kill you before the tumor does. Okay, hyperprogressive disease, well known in the field. Okay, why would you give a drug or any treatment to a patient that has a 15 to 20% chance of killing them, blowing the liver out, destroying their kidneys? I mean, this is nuts. This tells me that the field does not understand the biology of the disease they're treating. They're not trained in medical schools. They have no clue about how the power of nutrition and diet, again, together with drugs that work synergistically, can manage all these different diseases. And we have the science to support what we're saying. This is not like, I've done 25, 30 years of the mechanistic minutia that supports what I'm saying. But they should know the outcome of what we're saying is a manageable disorder. And Otto Warburg was the first to identify cancer as a metabolic disorder, but Otto Warburg never developed a therapy that would exploit what his knowledge base was. The only way I could get into that was my years of work with epilepsy before I could see the linkages and then see that we have another fuel that could be fermented besides glucose. So once I realized that, and I've offered, I have a $100 bill always in my pocket to any student that can show me a tumor cell that's doing really well without glucose and glutamine in the environment, okay? Fatty acids or anything. And they can't. We haven't found any yet. So, and people, and when you look at the research that's being done, sponsored by the National Institutes of Health, they're studying all these cancer cells in vitro, in the dish, the culture dish, and they're all growing in glucose and glutamine. And then I said, well, why don't you take away the glucose and glutamine? And they said, well, we won't have anything to study. What do? Do you want to resolve cancer, or do you just want to study it?
That'll do it for today. Please like the video if you did, and don't forget to subscribe. You can read many of the professor's papers at metcancer.com, and you can join our community at metcancer.com/forum. Now do yourself a favour and watch this video.